Hi, my name is Rob, and I'll be showing you how to apply your Strive medication patch. Make sure to apply the patch to an area of skin that's clean, dry, free from any hair, and free from any oils or lotions. Don't bend the patch. You'll remove the sticker from the center of the patch and pull the protective film from both sides until there's about half of an inch still stuck to the patch. Next, you'll apply the center of the patch with open adhesive to either your inner or outer bicep, equidistant between your elbow and your armpit, or as directed by your provider. If using a pain control patch, your prescriber may also advise wearing the patch close to an injury site. Here are some proposed sites where the patch may be worn. The patch should not be placed close to moving joints or worn where it will be subject to bending or pulling that causes the patch to fall off prematurely. Apply the adhesive on the top half, simultaneously removing the protective liner. Then you'll repeat the same for the bottom half. Lastly, you'll go over the edges to make sure the patch sticks well, and you'll apply pressure for 30 seconds. It takes time for the adhesive to set, so try not to disturb the patch or shower for the next 12 hours. For best outcomes, refer to the patient literature provided with the patch.